Have you ever wondered how our thoughts influence our behavior and emotions? How a single thought can spiral into a whirlwind of emotions and actions, sometimes even without us realizing it? Well, it's time to delve into the fascinating world of cognitive behavioral therapy, or CBT, a potent tool in understanding and changing these thought patterns. CBT is a combination of two therapeutic approaches: cognitive therapy and behavior therapy. Cognitive therapy focuses on our thoughts and beliefs, and how they shape our mood and actions. It's about understanding that our perception of an event, not the event itself, influences our reaction. On the other hand, behavior therapy targets our actions and behaviors, helping us to unlearn harmful habits and replace them with healthier alternatives. When these two therapies merge, they form cognitive behavioral therapy. CBT empowers individuals to identify and change destructive thought patterns that influence their behavior and emotions. It's not about eliminating negative thoughts entirely, but rather teaching us to approach them in a more rational and balanced way. The techniques used in CBT are varied and tailored to the individual's needs. These can include identifying negative thoughts, practicing new skills, setting goals, problem solving, and self-monitoring. The aim is to develop coping mechanisms that can be used in everyday life, equipping individuals with the tools they need to manage their mental health effectively. CBT was developed by psychiatrist Aaron Beck in the 1960s. Over the decades, it has been well-researched and proven effective for a variety of mental health conditions, including anxiety, depression, eating disorders, and substance use disorder. It's a testament to the power of our thoughts and how, by understanding and changing them, we can dramatically improve our mental well-being. But like any therapeutic approach, CBT isn't without its challenges. Change is never easy, especially when it involves deeply ingrained thought patterns and behaviors. The structured nature of CBT may not suit everyone and requires a willingness to engage in self-analysis and reflection. However, the rewards of this challenging journey are well worth the effort, as countless individuals around the world can attest. In summary, cognitive behavioral therapy is a powerful, evidence-based approach to mental health treatment. It combines cognitive and behavior therapy to help individuals understand and change their thought patterns, thereby influencing their behavior and emotions. Despite the challenges it may present, the benefits of CBT, such as developing coping skills and addressing a range of mental health conditions, are immense. So the next time a thought spirals you into a whirlwind of emotions or actions, remember that with understanding and change, you hold the key to navigating your mental landscape more effectively. Cognitive behavioral therapy is just one of the tools that can help you on this journey.